Welcome. I keep getting asked, what are the benefits to using bite turbos? And should I put the bite turbos on the posterior teeth? Because I see that routinely from orthodontists. Bite turbos are absolutely wonderful because what they're designed to do is to open the bite and avoid breaking braces off. So in the past, we used to put bands on molar teeth because they would break off, probably due to the occlusion. Now, if we put bite turbos on, we can use bondable tubes rather than bands. But here's the other part to it. Bite turbos help to open the bite. But now's the key here is, where do we put the bite turbos? Because in most deep bite cases, which is what we deal with predominantly, there's a curve of Spee. And with the curve of Spee, our aim is to level that curve of Spee. So if we put bite turbos on the first molar teeth, we're actually going to intrude the first molar teeth and make the curve of Spee deeper, which is exactly the opposite of what we want to achieve. So it's imperative that bite turbos in a deep bite case are placed on the anterior teeth, and in some cases you can place them on the second molars, because when you've got a deep curve of Spee, the second molars have over erupted. But you never want to place them on the first molars. Now, on the other hand, a patient who may have an open bite, you want to intrude the first molars. And they're the patients that you would like to put your bite turbos on the occlusal of the first molars, or on the occlusal of the upper first molars. But the majority of our patients are deep bites, and they should be either placed on the anterior teeth, on the palatal aspect of the upper canines, laterals, incisors, doesn't really matter, or the occlusal of the upper second molars in a deep bite case. So once again, I reiterate, in a deep bite case, you should not be having bite turbos on the first molars, because you're going to intrude the first molars further and increase the curve of Spee, which will in effect worsen your deep bite.